Welcome to a special question and answer session with Dr. Rodrigo Rodriguez at BioCare Hospital and Wellness Center in Tijuana, Mexico. I am Lindsey Williams. For a free consultation, you heard me correctly. I know you don't get that in other parts of the world, but for a free consultation with a doctor at BioCare Hospital, call the toll-free number right into the hospital in Tijuana, Mexico, 800-262-0212. And when you call, ask for their 60-page booklet, which will be sent to you free of charge. Dr. Rodriguez, I continually hear patients saying, I have come back to BioCare Hospital for a tune-up. I had cancer 5 years ago. It's in remission. I'm living a normal life. I had cancer 10, 15, 20 years ago, and it's in remission. And I come back once a year to get a tune-up. At BioCare Hospital and Wellness Center, what is a tune-up?
I'm going to tell you something, and this is something that patients in particular, and many times doctors as well, forget. Every time you go through a disease, every time you go through a healing process, there are two things that you have to remember. If you regain your health, you have to think, what made you sick in the first place? So you don't do that again. Let's say you are an alcoholic and you are recovered. What brought you to be an alcoholic? Alcohol. So you don't do it anymore. You avoid it. Then, if you have health problems, a metabolic problem, diabetes, high blood pressure, it is probably food that brought you there. So you don't repeat the same type of foods, you have to do it in a different way. And there is no better way to do it than by doing a regular checkup. A regular checkup when you go to the doctor who knows what is your diagnosis, what is what you went through, and is going to check all the variables, all the parameters that he feels are important for your personal problem. And while doing that, I'm going to make sure that I refill, so to speak, intravenously or orally or through food, the elements or the nutritional substances that I know are important for your diagnosis. That I make sure that I do the anti-inflammatory processes that I think are going to be also important for your case. In other words, I'm going to be reinforcing. I'm going to be trying to boost what we already have accomplished. And no better way to do it than going back to the hospital, now for just a few days, talk to the doctor, think of yourself, use a lot of time. We don't do it. Let's use time to treat us well. And when you go to that hospital again, and you do it because you're healthy, because you're in remission, you're going to have that remission lasting longer and longer and longer, and ideally forever. But if you stop, you had a successful treatment and you stopped altogether, and you go to your old lifestyles, to your old ideas of how to live it well and fun, etc., you're going to have a short-lived remission. And we don't want to do that. We want you to come back and come back and come back, and hopefully just to say hello. We have people, you have seen it, people that come to us several years after, or they come every so often, and then it's a joy, because we have celebrated birthdays of people that in theory should be dead. And they come back for a boost, for a tune-up, as we call it, and then we say, oh my God, it's been 5 years, it's been 10 years, it's been 20 years. And nothing, believe me, gives me more joy than those experiences.